My name's Nathan Bennion. I was born in Utah and raised in Chesapeake, Virginia. I studied neuroscience at Brigham Young University and then returned to Virginia for medical school. There I studied at the Medical College of Virginia at VCU. I was fortunate to discover UNMC as a residency for radiation oncology. Here I had some great experiences both in the clinic and in the community, and that's what encouraged us to stay. With radiation oncology, we see a variety of conditions. They range from those in the central nervous system, head and neck, in the chest, abdomen and pelvis, but my focus here at Nebraska Medicine is mostly on the breast cancer and gynecologic malignancies. First time I meet a patient, I like to first review for them all of the previous studies, treatments, things that they've gone through, and kind of form a picture of where they've been and explain to them why. That gives us some context then for me to ask them questions. I can learn about their goals of care, what have been their strengths through the process, as well as some of the things they've struggled with. Once I know where they've been and we've come together and formed some goals, then I like to tell them, what are their options? What are the risks and the benefits? I want to perform more as a consultant so that we can have some shared decisions. Academic medicine, it enables me to get a little closer to the questions that are being asked right now by clinicians or scientists, even patients. And when we ask those questions, it affords me a venue where we can collaborate. We can turn those questions into an actionable concept or a study. Afterwards, we can get the word out and we can tell people, what did we discover? What were the improvements? And I can watch that go from the bench in the research lab all the way to the bedside. More specifically for radiation oncology, I get to enjoy some of the cutting edge of medicine and science. The technology that we have really fascinates me. And to be able to bring something new in a field that's constantly changing, that's really satisfying. It's really easy for me to find meaning taking care of people who have cancer. Between experiences of my own and those that I've had in the field of medicine, really it's close to home, and I feel like it's a place where I can bring something to the table. I really enjoyed some of the serious conversations, some of the serious decisions, as well as the successes and the celebrations. It's easy for me to find meaning in oncology.